Good evening. Thank you for joining us on the news at 10. I'm Evelyn Schultz. A new report by state health officials revealed multiple escapes by children being treated at Helena's Shodair Hospital during the previous year. It was compiled after a 15-year-old girl escaped the hospital in July and then ran onto nearby Interstate 15, where she was struck and killed by a vehicle. Mike Dennison obtained the report for MTN Investigates and spoke with Shodair officials and others about the lapses identified in the document and what the hospital is doing to correct them.
Shodair is a 74-bed private nonprofit hospital that provides residential psychiatric care for children. Last year, it treated 1,800 kids from ages 3 to 18. Yet the hospital was shaken to its core this July when 15-year-old Kayla Neal of Missoula broke out of the facility, ran onto nearby Interstate 15, and was hit by a vehicle and killed, in full view of some hospital staffers.
I think with the families, it's been very traumatic, especially with the parents of the daughter. It's affected a lot of employees. There were several employees who watched the entire incident from start to finish, and we have lost some employees over this just because of the trauma of it.
Within days, reviewers from the State Health Department's Quality Assurance Division interviewed hospital staff and then filed a 46-page report and follow-up. The report, obtained by MTN Investigates and publicly posted last month, revealed that Neal was not the only child to escape from Shodair this summer. In fact, she was one of 3 girls who fled the grounds that day after they broke a fire alarm that unlocked outer doors. The 2 other girls had escaped the day before as well, and 4 additional kids had escaped or attempted to escape the previous month, including another girl who ran across the interstate and was later returned to the hospital unharmed. At the time of the incident, there wasn't even a fence blocking the interstate. The state agreed to install this one behind me, but OSFED says the hospital is doing a lot more to address the problem. The report said Shodair fell short on several fronts related to the escapes. It said the hospital failed to establish a process for staff to follow if a patient escaped and did not train staff on that procedure. And perhaps most importantly, it said the hospital did not conduct what's called a root cause analysis of earlier escapes, including one that happened a year ago.
This is a very troubling report. Very good psychiatric facilities do root cause analyses when kids elope from their facility and when other serious events occur. This is a problem that they knew they had, but unfortunately did not analyze because they didn't conduct the root cause analyses that they needed to conduct.
Brenneman's group monitors facilities that treat people with disabilities. OSFED says in the wake of the report, the hospital made immediate changes and filed a plan of correction in August. Fire alarms have been relocated inside secure nurses' stations, staff are trained how to handle elopements, and the hospital conducts elopement drills. Since the July death, no patients have eloped.
There were things we weren't doing right. And I think this pointed it out, is that we're not a perfect organization, and it really forced us to go back and look at our own procedures. And I think we knew we needed to look at that, and I think this report also made the same conclusion.
Brenneman notes the hospital is still close to a busy street and the interstate and wonders if additional security or safety steps are needed. Shodair says it's not a correctional facility and doesn't want fences around the building, but it is exploring steps to slow area traffic. And state regulators, as well as Brenneman's group, will be watching. So is Shodair doing enough to prevent future elopements? They hope so, and that's the question that the state and other regulators will address when they revisit the hospital's response. Reporting from Helena, Mike Dennison, MTN News.
State health regulators will conduct unannounced visits at Shodair in the future, just as they do at any hospital as part of regular reviews.